here because of COP10, which is the Framework Convention on Tobacco Control, and the Conference of the Parties, right? It's pretty much where 1,500 members and people from the governments and tobacco control decide the fate of 1.3 billion people around the world and their access not only to harm reduction products, but the regulations that they're being impacted with when it comes to tobacco consumption and cigarette consumption especially. My duty to here today is to introduce these guys, which is part of the medical professionals when it comes to Latin America. They're all in favor of harm reduction whatsoever. We're going to explore a little bit of why their expertise is relevant when it comes to the harm reduction movement. Okay. First of all, we have Diego Verrastro from Argentina. He's the spokesperson from RELDAT, that is the Latin American network of medical professionals that is in favor of harm reduction for people who smoke. And I'm going to ask him to introduce himself. Diego, ¿por qué estás envuelto en esto de reducción de daño? Sé que sos el vocero de RELDAT. ¿Y qué te motiva a estar dentro de todo esto también? I'm asking what is the motivation that Diego Verrastro has in order to be involved within this harm reduction movement, and why his expertise is relevant to the harm reduction movement.
Buenas tardes para todos. Soy médico argentino, tengo las especialidades de cirugía en emergentología y en obesidad, y me acerqué a la reducción de daños porque soy un exfumador que no pude en ningún momento, con todas las terapias y teniendo el alcance a la mano, el alcance de esas terapias, poder conseguir dejar de fumar, hasta que de casualidad, porque realmente fue un hecho azaroso, encontrarme con las herramientas de reducción de daño. En este caso, en el mío fue con un vape, y fue lo que me ayudó a abandonar el tabaquismo. Yo era un fumador de 60 cigarrillos diarios, y a raíz de esto empecé personalmente con una inquietud como médico de ver de qué se trataban estas herramientas, estos productos. Y ahí fui interiorizándome cada vez más, y teniendo la noción de que esto no solo me podía haber ayudado a mí, sino ayudar a un montón de pacientes y a un montón de personas que estaban transitando lo mismo que me había ocurrido a mí. Y ahí fue donde empecé a leer, a buscar información, información formal y información informal por todos los canales que tenemos los médicos. Y ahí me di cuenta que, bueno, había que alzar la voz en lo que son las herramientas de reducción de daños y empezar a trabajar con la gente que no podía dejar de fumar o que había intentado dejar de fumar, y poder transmitir que toda la experiencia, y que era abrumadora, no solo por todo lo que había leído, por todo lo que había estudiado, sino también por lo que había ocurrido con mi sistema, con mi organismo, al haber abandonado el tabaquismo utilizando estas herramientas. Después se fue dando toda la lucha de como médico, de tratar de que otros colegas y la comunidad médica pudiera comprender el gran desafío que era utilizar estas herramientas para todas las personas que estuvieran fumando, ¿no? Y generar conocimiento y generar opiniones, todo para un bien común, sobre todo para mis pacientes. No me olvido que somos médicos y que lo que nos mueve es la salud de nuestros pacientes, ¿sí? Esto es fundamental, el tener como profesionales de la salud todo un armamento, todo un montón de herramientas que podamos usar al abordar una patología. Los cardiólogos tendrán muchos antiarrítmicos, los oncólogos muchas drogas oncológicas. Bueno, los que hacemos reducción de daño por tabaco necesitamos tener cada vez más herramientas para poder ir adaptándolas a cada uno de los pacientes, a cada una de las poblaciones que nos toca asesorar.
It's kind of explaining why he got involved into this. He used to smoke around 60 cigarettes per day. He started vaping in order to quit smoking, right? He found it useful, so he started researching on this, right? And, you know, pretty much with the intention of helping his patients have access to harm reduction products or alternatives to help them to quit their cigarette use, right? He thinks that people should have the more alternatives and the best arrangement of tools in order to decrease the number of cigarettes that they use or completely quit, right? But he says that it is important for them, like any other expertise, like any other disciplinary, when it comes to the tools that they can have in order to advance in the health of their patients, that people should have different options to quit tobacco when it comes to cigarette smoking, and it is in favor of public health. He's involved a lot with in his level of expertise and pretty much his line of work. It comes with people that are dealing with obesity. So he says that he is something that is actually effective for them to have the best range of tools on their capabilities, like in some other medical practices. As well, we have Randall Rodriguez. He's from Costa Rica. He's involved in a lot of HIV treatment and harm reduction, which is really, really interesting. Something that actually started when it comes to harm reduction. It started in HIV back in the 80s when it comes with Canada and the United Kingdom in order to help people not get infected by HIVs or dealing with AIDS. Randall, es muy interesante, digamos, tu posición porque estás en una práctica, a pesar de que estás metido en reducción de daños por tabaquismo, también estás muy adentro de lo que es el tratamiento de personas con HIV y SIDA, lo cual es el inicio de la reducción de daños o el movimiento de reducción de daños más fuerte dentro del 1980 de lo que es Canadá y el Reino Unido, por ejemplo. ¿Cómo te interesaste en meterte en el lado de tabaquismo? ¿Qué crees que te aporta tu nivel de experto, digamos, en el tratamiento de estas personas para ayudar a la causa pública de ayudar a 1.3 mil millones de personas que actualmente fuman?
Okay. Bueno, primero que nada, buenas tardes. No sé si me escuchan aquí. Buenas tardes. Bastante contento de estar en este hermoso país. La verdad que me han recibido bastante bien, yo creo que a todos mis compañeros. Hermoso está la ciudad. Aquí el casco viejo, increíble, tenía muchos años de no venir. Los felicito porque de verdad lo tienen muy bonito. Mi nombre es Randall Rodríguez Obando, yo soy médico cirujano, graduado de la Universidad de Costa Rica. Tengo un posgrado en una maestría en VIH en la Universidad del Rey Juan Carlos en España, y tengo más de 10 años de trabajar con esta población. Hasta por mi perfil, yo soy todo un cirujano, ¿verdad? Entonces casi un cirujano atendiendo población o pacientes con enfermedades clínicas meramente. Llegué por rebote a trabajar con la población porque muchos médicos no querían trabajar, les cuesta mucho trabajar con esta población, con las personas que viven con VIH. Lamentablemente, muchísimas de estas personas que viven en condiciones de callejización, que conviven con VIH, tienen problema de consumo de sustancias psicoactivas. Y caí en la reducción de daño por rebote. ¿Por qué por rebote? Porque lográbamos notar, Costa Rica es un país bastante conservador y las reglas, por lo menos en ese tipo de instituciones, son muy marcadas, y el paciente que salía del hogar, del albergue en donde trabajo, si salían sin permiso no podían regresar, porque eran personas que tenían problemas de consumo de sustancias y se iban a consumir, entonces se volvió una revolución dentro del hogar. Entonces empezamos a notar que es muy sencillo, en VIH se van, dejan botado el tratamiento antirretroviral, a los 3 meses se vuelven a caer súper enfermos en un hospital y los volvemos a recibir. Entonces parecía hasta tonto, se les negaba el acceso inmediato, pero espérense 3 meses para recibir los enfermos con una tuberculosis, con un meningococo, y muchas veces a morir. Entonces empezamos a notar, historiándolos clínicamente, haciendo una historia longitudinal de cuál era el problema, por qué se iban. Y muchos coincidían que lo que salían, que lo primero, se nos ocurrió preguntar, ¿y qué fue lo que primero que hicieron cuando salieron escapados del hogar? Fumar tabaco. O sea, lo que más los empujaba a irse era consumir una dosis de nicotina. Y fue donde vimos que, ¿cómo hacemos? Y Cartago todavía es una de las provincias más conservadoras de Costa Rica. Y si Costa Rica es conservador, Cartago es el doble, que es la provincia donde está el hogar. A mí me tocó presentar con el psicólogo del hogar la alternativa de reducción de daños en tabaco y darles alternativas de nicotina a los pacientes con VIH. Todos cayeron para atrás como condorito, ¿verdad? Plop, ¿qué es esto? ¿Cómo les vamos a dar dosis de nicotina a los pacientes que tienen VIH? En ese tiempo los miembros de la junta directiva, como entre 7, sumaban como 2 millones de años más o menos, entre todos. Gente muy conservadora y costó poder meter eso. Entonces, ¿qué nos tocó? Ponernos a estudiar, buscar la base científica de qué es el modelo de atención de daños, de reducción de daños, y empezamos a implementarlo y vimos que era exactamente lo que servía. ¿Qué hacíamos? Que dábamos dosis de nicotina como dosis de medicamentos. Tan así que estaban indicados en un cárdex, los manejaba en enfermería, había toda una... ¿Y qué logramos? Demostrar el descenso de los abandonos de terapia antirretroviral. ¿Y eso en qué se traduce? En que se moría menos gente, se nos morían menos. Eso es un punto duro para nosotros que lo manejamos en medicina, donde estamos demostrando que así sirve. Pero es que es una alcahuetería, así en Costa Rica, no sé si en todos los países, es una alcahuetería estar dando nicotina, pero entonces ¿qué prefieren? Que se mueran. Entonces logramos implementar y me tocó meterme mucho a estudiar esto de reducción de daños. Y es ofrecerles a las personas que no pueden o no quieren dejar de consumir, y todavía esos niveles, porque al no dejar el consumo, empiezan a abandonar sus tratamientos y se van a morir. Fue donde notamos que es un terreno fértil para poder seguir aplicando la medicina de una forma muchísimo más efectiva. Nadie puede negar que la abstinencia es una forma de abordar, pues no es la única, y ha demostrado que no sirve. O sea, nadie ha podido demostrar que la abstinencia sirva. Entonces, ¿qué hacemos? Y yo pongo el ejemplo como el paciente paliativo. Yo creo que eso nos va a servir de ejemplo y eso es lo que estamos acá. Lo mejor, y yo las oportunidades que he tenido que ir a dar clases hasta chicos de escuela, eso es súper interesante, ver a los papás cuando uno les habla de alternativas y de VIH, les paran el pelo. Y yo les ponía el ejemplo, que lo ideal en un cáncer de cervix, todos sabemos que es un cáncer de cervix, lo ideal es que a la paciente no le dé, eso es lo mejor. Pero ¿qué pasa si a la paciente ya le dio cáncer de cervix? Habría que tratar de curarla. Pero lo ideal era buscar todas las alternativas para que no le diera, que papá Nicolaos, que usar preservativo, etcétera, pero no sirvió, le dio cáncer. ¿Qué vamos a buscar como médicos? Tratar de curarla. ¿Y podemos curar a todas las pacientes que tienen cáncer de cervix? No, no las podemos curar. Entonces, ¿qué hacemos con esas pacientes? Toca pasarlo a otra etapa de la medicina, que es medicina paliativa. Es tratar de aliviar el dolor, darle alternativas para que la enfermedad no avance tan rápido, pero tenemos claro que no se va a curar. Eso es exactamente lo mismo que pasa con tabaquismo. ¿Qué es? Lo ideal es que nadie fume, y ninguno de nosotros, los que hemos trabajado en reducción de daños, negamos que lo mejor es la educación, no queremos que nadie fume, pero ¿qué hacemos con las personas que ya fumaron? Si ahí están los datos, como dice Jeffrey, hay 1.300 millones de fumadores en el mundo, o sea, las políticas no han servido, hasta ahorita no, porque cada vez hay más fumadores. Entonces, ¿qué hacemos con esos que no pueden dejar de fumar? ¿Los eliminamos del sistema? No. Les ofrecemos la abstinencia, curarlos. En menos del 1%, menos del 40% lo intentan, y de esos ni el 5% lo logran. Entonces, sí, ofrezcámoselos, pero no es la única alternativa. ¿Qué hacemos con aquellos que no pueden o no quieren dejar de consumir el tabaco? ¿Qué nos toca? Ofrecerle una alternativa, que puede sonar horrible la comparación, que es paliativa. Sí, yo no lo voy a obligar a que deje, lo que quiero es que se haga menos daño. Y eso es lo que nos dedicamos a reducción de daños en tabaquismo. No es que no creemos en la prevención, no es que no creemos en la abstinencia, no, es que hay más de esas dos opciones. Habrá gente que trabaja en prevención, otros trabajan en la abstinencia y nosotros trabajamos en todos esos. De verdad que nosotros somos los que tenemos más clientes, porque la mayoría de los que fumaron no logran la abstinencia. Entonces nos dedicamos a ofrecerles alternativas. ¿Cuál? La que el paciente quiere. ¿Y qué buscamos? Que se regule, que la gente tenga acceso a las diferentes alternativas. Y convencer, que casualmente nosotros los médicos somos los más reacios, parece mentira, a entender que ese es el modelo de atención. Si el trabajo de nosotros no es educar a la gente, es educar a los médicos, y es bien difícil meterle a un médico estas ideas. Entonces, agradecerles la oportunidad y espero poder seguir compartiendo las diferentes ponencias y que se arme la discusión. La idea es que todos compartamos nuestra opinión de una forma educada, respetuosa y de que crezcamos, que el debate nos lleve a buen punto.
Brunter goes back in time about his life experience, especially on his area of expertise, that is the dealing with people that have HIV or dealing with HIV, and how these people actually stopped their treatment or quit their treatment because they were not able to continue to smoke. So, and he was actually working on a place in Costa Rica that is ideological, is really moralistic. So it's not like progressive on this kind of thoughts. So what they did is that they start looking for ways in order for people to stay into the program and treat their HIV condition. And what they did is pretty much is starting sort of prescribing nicotine dosage to people that are dealing with HIV so they can stay in the program. He talks a lot about the importance of providing people with alternatives when it comes to dealing with this particular and different areas of health, right? And he as well dwells a lot into the importance of how this abstinence-only approach has not been successful in many areas, not only on tobacco, but in some other areas. And one of the reasons why he thinks that what is going on with the current state of tobacco and the prevalence of tobacco in the world, where we have 1.3 billion people currently smoking and have not decreased much, to the point that he says that the abstinence-only approach has not been successful because 40% of the people, or less than half of the people that actually try or that actually smoke, try to quit cigarette consumption whatsoever. Less than 5% is able to be successful in doing so. So he says that their job as the network of medical professionals is not that much into dealing with people that actually are consumers, but to give information to the medical practitioners and the medical professionals that are really reluctant to get an idea of what is the harm reduction approach based at and what actually can do for people, and as a service or as a method can help to advance in public health. We have Carmen Skrik. She's from Spain. I know that you have been here in this area, harm reduction, especially tobacco harm reduction, from the beginnings. You know, if we think back into Carmen's career in harm reduction, especially for people who smoke that are unable or unwilling to quit smoking, she was 15 years ago in, pretty much helping from the ground up when there was no organization, no consumer organizations available, when nobody was actually even, consider this as an approach for people in Spain or pretty much anywhere in Latin America or Iberoamerica. She was there already trying to argue that what this approach could help or what it can do for people. And as cell biology and genetics, what your area of expertise can bring to this area, or how do you get that sorted out into harm reduction, or how can that help harm reduction, and what motivates you? Tu área, digamos que es la biología celular y además es la genética, ¿cómo se anexa a lo que es esta lucha por reducción de daños, que yo sé que vos has estado desde el principio metida en eso? Hace 10, 15 años estabas tirada en el suelo dibujando carteles con ángeles hablando de esto, cuando no había nadie hablando de esto en Iberoamérica, en español no se conocía nada de este enfoque de reducción de daños. ¿Qué te motiva a estar en todo esto?
A ver, yo un poco como Diego, yo tengo esa dualidad, ¿no?, de ser doctora en biología molecular, conocer la manera en que puedes abordar la ciencia con un sentido crítico, y por otro lado considerar que a mí, en este caso, los productos de reducción de daños, el vapeo, a mí me salvó la vida. Yo era fumadora de 2 paquetes diarios durante 18 años. Yo no me veía capaz de ninguna manera de dejar de fumar y tardé un montón de tiempo en tomar la decisión de dejarlo, ya por decir o lo dejo o me mata. Y justo coincidió en ese momento que en España empezaba a haber el boom de las típicas tiendas de vapeo que aparecían por todas partes. Digo, voy a probarlo porque peor que el tabaco no puede ser. ¿Y cuál fue mi sorpresa? Que lo probé y hace 10 años de eso. Hasta hoy yo no he vuelto a tocar un cigarrillo. A mí eso me cambió la vida de tal manera. Es decir, el terror que yo tenía a dejar de fumar y que un simple cacharrito, que es una batería y un líquido, consiga que yo, con lo que he sido yo, que me he fumado lo más grande, como se dice en España, ¿no? A mí me cambió la vida. ¿Qué pasa? Que yo en ese momento me pilló en el impasse en que yo había leído la tesis doctoral, estaba de paso a seguir investigando en mis temas de investigación, y en ese momento digo, bueno, tengo tiempo, voy a leer. Y me puse a leer lo que en aquel momento, estoy hablando de hace 10 años, ya había publicado sobre ciencia y reducción de daños por tabaquismo. Y como tenía el sentido crítico, me di cuenta, digo, a ver, si en mí ha funcionado, ¿por qué no va a funcionar en los demás? A nivel toxicológico, no es un problema. ¿Dónde está el problema? Justo en ese momento me paso a enterar de que en Europa se está transponiendo la Directiva Europea de Productos del Tabaco, una directiva que alejaba este producto del fumador. Al mismo tiempo en España estaban las legislaciones nacionales, también empezaba el lobby del control del tabaco a pedir la equiparación, empezaba toda la oleada de desinformación. Y tuvimos en España un punto crítico, que fue la falsa publicación de el primer muerto por vapeo en el mundo, por una supuesta neumonía lipoidea. Aquello provocó que el 95% de las tiendas de vapeo que había en España en ese momento cerraran, se hundió el mercado. Yo me indigné porque yo sabía que a mí eso me había salvado la vida, que había toda una comunidad de gente random, usuarios ayudando a usuarios, que estaban ayudando y sacando a la gente del tabaquismo de una manera que yo no había visto nunca. Y entonces, básicamente me fijé en qué es lo que hace falta, ¿no? ¿Qué hace falta? Tenemos usuarios, tenemos una buena comunidad de usuarios, organizar a los usuarios. Ahí nació ANESVAP, la Asociación de Usuarios Española. Los empresarios se organizaron por sus medios y tienen sus cosas, pero hacían falta médicos. Hacían falta médicos durante muchos años, mínimo los 3 o 4 primeros años, yo fui la única doctora posicionada públicamente a favor de la reducción de daños en España. Y poco a poco yo me creé la misión personal de ir juntando doctores, ir enseñando evidencia, porque los doctores no tenían acceso a esa evidencia. Los doctores solo tenían acceso a lo que les venía de las cúpulas de las asociaciones médicas y a lo que les venía de los titulares de prensa. Los doctores no leen papers, a no ser que les digas que se los tienen que leer. Y ahí viene el problema. Su sociedad lleva una línea y ellos siguen esa línea porque obviamente nunca van a dudar de los presidentes y las directivas de las asociaciones médicas. Claro, cuando tú consigues hablar con un doctor, sentarte con él, le plantas delante el RCP, el Public Health England, hoy en día le plantas la Cochrane, le plantas toda la evidencia, claro, los doctores dicen, es como muchos de ellos, como si se les cayera un velo y dijeran, pero ¿por qué me han engañado? Pero luego nos tocamos con otra barrera y es el miedo. Tengo una lista inmensa de doctores con los que yo hablo, que conocen la evidencia, que apoyan la reducción de daños por tabaquismo y que tienen miedo de posicionarse públicamente. Y ahí comienza toda una labor de intentar juntarlos, darles el valor y simplemente yo lo que hago, porque mi trabajo, a mí lo que me da de comer es mi empresa de toxicología propia, ¿vale? Yo hago esto porque creo en ello, a pesar de lo que se diga por ahí, ¿no? O lo que pueden decir de todos nosotros. Yo tengo mi trabajo. Yo esto lo hago porque creo en ello, porque considero que correctamente regulado, correctamente incentivado, es el fin del tabaquismo. Pero para eso hay que querer que lo sea. Entonces, claro, mi labor es intentar juntar la mayor cantidad de doctores posible y simplemente que hablen y que surja la magia. Y a partir de ahí, pues bueno, nació la Plataforma Española para la Reducción de Daños por Tabaquismo y poco a poco, pues mira, trabajando también con usuarios, porque los usuarios son una parte muy importante y muy olvidada en el debate de salud pública sobre la reducción de daños por tabaquismo. Entonces, es crear sinergias entre ellos para que nazca la magia. Y a eso me dedico y por eso estoy aquí. Básicamente porque considero que a mí esto me salvó la vida y creo en ello.
Carmen started vaping 10 years ago when she got into a crossroad about her health, and is I stop smoking or I die because of this. She said that since it was successful for her, she started digging in, looking at the info, looking at the evidence while she was doing her thesis in cell biology and genetics. And when she started reading information and evidence 10 years ago, she got to notice that there's a lot of information that doctors do not have access to. She began by putting together or helping to put together the consumer organization of Spain, that is ANESPAP. That is currently still going on, but she noticed that there were a lot of people that were not willing to get involved from the medical side, right? So she was alone for 4 years as a public doctor who actually is voting for the harm reduction approach for people who who are unable or unwilling to quit smoking. And she got to that situation where she was alone. And at that time in Spain, there was a situation where there was a doctor that said that lipoid pneumonia was causing the first death of vaping. Back then, she was so aggravated and so frustrated because she knew that it was not true, that it's impossible to have or develop lipoid pneumonia from this particular devices because of the toxicology aspects of the device itself and the nicotine, the e-liquid that is used. So she got into that mission of giving access to information to doctors about these particular devices so they can actually know what is actually the harm reduction approach about. She noticed that when it comes to doctors, there's two things that they're facing. One is the evidence that is not freely available to them, and the other one is fear, because they're scared of putting themselves publicly in favor of this approach because of some other actors that can take it against them because of ideological aspects or that it can be bullied somehow. She definitely thinks that harm reduction is the approach that could actually end smoking in this lifetime. And she now dedicates herself, even though that is not his particular income or is no income for her to be involved in these particular aspects, because she have her own toxicology company. That's pretty much her source of income whatsoever. She dedicated just because of love and passion to help people or to develop these networks of medical practitioners to get information and start the debate within them so they can know that there's a different side of the story. So, thank you very much, guys. Muchísimas gracias. Es un placer, y hasta ahora que estamos iniciando esta conferencia, now that we're starting COP10, I think that all voices must be heard, not only from consumers, not only from the members of the parties of the FCTC, not only from the people from tobacco control, not only from medical practitioners, but every single voice should be heard. And I'm really glad that we're here. I do think that we're making a difference, and I do think that some things, even though that at this present time it looks like it's not, some good things are going to come out after this COP. Yo creo muy bien de corazón que cosas buenas van a salir de esta COP, y esperanzado en Dios, yo creo que pronto lo veremos. Muchísimas gracias. Thank you very much, everyone.
Abajo para que el proyector no le quede en la cara. Aquí. Aquí puede ser aquí. Sí.
Sit on there because that worked well with
Yeah.
Jeffrey, didn't it? I'll sit on there. I can see everything.
You'll sit here. Oh, okay.
Yeah, of course. Not mine. That's fine. That's perfect.
Hola.
Ready? The duck face? Find your good side. I don't, you have to find your good side.
Oh, okay. Yeah, I'll use one. I've only got three headsets. You got it. Hello everyone, welcome to the second of our expert introductions sessions. As I said this morning at the start, I'm very proud of the lineup we've got, and I'm very proud that we're going to be introducing all of them to you one by one. So today we've got Alberto Gomez from Spain, Roberto Sussman from Mexico, Maria
P.
from Canada, and Philip Kovic from Croatia. So we go along the line because it's not about me, it's about introducing these guys. So Alberto, do you want to tell us, how you got into this, or what your role is, what you think of COP here, and what you're doing here, and what your hopes are for the future of harm reduction?
Sure. Thank you very much for the invitation. So I'm Alberto Gomez. I am the policy manager at World Vapers Alliance, a non-profit organization defending vapers' rights. And I've always been working with pro-liberty movements, and I work at several think tanks and non-profit organizations before. And I started working with the World Vapers Alliance because even though I'm not a vapor, in my family there has been a few heavy smokers, including my father, my brother, my grandfather. And, well, my grandparents, he didn't quit. he's still a smoker. But my father, he used to smoke 2 packs of cigarettes per day, and thanks to vaping, he managed to quit, and now he's much healthier. He's been 2 years smoke-free now. Same with my brother. And so this was a flag that I wanted to take, and I wanted to help pushing for tobacco harm reduction and vapors' rights. And you asked me what I think of COP, what my thoughts for COPs are. Well, I see COP as a very large threat to us, to vapors. I think that it's very dangerous when these governmental organizations work and take decisions without the consent and without considering the comments and the ideas of those who are affected the most by this decision. So that's why we came here, right, to fight it, to make sure that consumers' voices are heard, to make sure that they take a pragmatic approach to vaping and tobacco harm reduction, and that they listen to what science actually says, what consumers says, the testimonials of the millions of people that have already quit thanks to vaping. So yeah, hoping to change that, and that's why I'm here. Thank you.
Can I ask
Also to meet politicians, policymakers, to make sure that they understand what tobacco harm reduction is about, and to give them feedback from consumers, to give them scientific papers so that they know how it really works. And my feeling is that we are progressing, we are making progress. I think from the general public view of point, it's very clear. The last polls that have been made in the last few years show that people ever understand more and more that vaping helps as a tool to quit smoking. And also from politicians, my feeling is that they are more aware and more aware every time that we meet them. Of course, there are some that they never take what we explain to them. They never really support our cause, but some of them are getting more conscious about what we defend. They also feel the pressure of the thousands and thousands of people that use vaping as a tool to quit smoking, and they are starting to understand and to be aware of how it works. So I think science is on our side, the testimonials of the people are on our side, and so it's a battle that is going slowly, but I think we're making progress, and we're going to make it happen.
Thanks. And I'll introduce Roberto's sister. Many people know his name very well. Recently gave Mike Russell oration at GFN last year. He's an astrophysicist, I think. Am I correct in saying? So
Yeah.
he's gone from looking at stars to talking about vapor products. So that's that progress. But do you want to explain, Roberto, who you are, what you do, and why you're here?
Well, I am in a sort of combination because I'm a user. I have been vaping already for 7 years. I have a long story of smoking. I still smoke occasionally. And I am also a scientist. So I have the training to understand the literature. And in the case of the what is called electronic delivery systems, there is physics. I'm a physicist. And okay, I study galaxies and clusters of galaxies, but it's physics. The aerosols are also part of physics. So I have this combination, these two separate interests. And I have been, in the last 6 years, doing serious research on the emissions, because when we say vaping is safer than smoking, you can say, well, that's your opinion. But we have to support this opinion by hard evidence. And science has a methodology, and there are procedures, and you cannot just invent facts. You have to detect them in the laboratory. And I have associated myself with people who have laboratories where they can do the experiments. And I've already published papers. And I think that this is a very important element in this discussion, because it's not an opinion. It's not that I enjoy vaping because it's pleasant and so on. When we say this, the other side, the detractors, they say, that's an anecdote, doesn't count. Well, I can say, no, it's not an anecdote. I can support that with my own work. And it is open, it is public, it can be checked, verified, and so I'm developing in this direction. Now, what is the response of the other side, the detractors? Well, it is very difficult to make the scientific point. And here we come to the issue that harm reduction, the scientific part of it is very important, but it is a political issue. And sometimes you might have very good evidence, but you are on the weak political side. And so this is our struggle. But we have to keep going on, because in the end, the hard evidence will prevail. And I'm convinced of that, and I will continue on this line. And another point I want to make that is very important is that I already spoke about the scientific aspect, but there is also the consumer aspect. Just think this idea. Very few consumer products have been so much attacked at the institutional level, right? And how come consumption still goes on? It is important because there is one level, institutional level, the WHO, the medical institutions, many of them, they are decrying, they say the product is toxic and it's a tobacco industry strategy and so on. There's a discourse on that level. But that's what happens below the pyramid. Below the pyramid, you have consumers using the products. In spite of all these things, of all these problems, consumers are using. And this is what will save the day, the consumers. And we see, let me just tell you something and I'll finish with this. Suppose that the vapes and heated tobacco products, most the vapes, because they are more widespread, they were only 10, 15% as dangerous as what are they described. We would already have 6 or 7 or 10 evalis. We have only had one, and it was not caused by the substance, by nicotine. So the products, this is what I'm describing, is a global experiment. It's a global experiment that is happening right outside there. In spite of the discourses of authorities and so on, you have millions of consumers that are enjoying the products. Many of them, I would say most of them, are quitting smoking or smoking much less. And they are not getting sick. And this is advancing. And this is what will, in the end, force the authorities to look at the problem. Because now authorities are avoiding the problem. They are avoiding the science. There is a science dedicated to find harms that we have criticized, right? And this continues. But there will come a point where this reality that I'm describing will strike their faces. It's a long road. It's going uphill, but we should follow it. We should follow it. That's my message.
Thanks. Is that working? Yeah, thanks. I noticed there you said, I'll finish with this, but you're not finished because I'm going to ask you a question. Since you're a scientist, we know, don't we, that in the COP10 meeting up the road, they're talking about one of the agenda items is on Article 9 and 10, which is contents and emissions and testing of products, especially vaping products and heated tobacco and everything. And they want to redefine smoke, which you know about. So I'm going to ask you this. They say that, strictly speaking, visible aerosols deriving in whole or in part from thermally driven chemical reactions qualify as smoke, even when combustion is not involved.
Well,
comment on that.
If that is true, suppose, I'm using the devil's argument, suppose this is true, then say goodbye to smoke-free restaurants and kitchens, right? Because when you cook something, you generate an aerosol in exactly this way. It's a thermal reaction. You put the pan and the food, and you heat it. You are heating it, right? You're not putting, sometimes you can burn it, right? With charcoals or whatever. But you are producing an aerosol by thermal reactions. If the WHO is saying that this is smoke, then you are smoking whenever you are cooking. There are no more smoke-free restaurants, no more smoke-free kitchens. It is evidently a political discussion. It's like, for example, we can call, I use this, it is a very, very strong argument, and it is an analogy, so take it carefully. Suppose you want to oppose people having sexual relations outside of procreation, and then you define sexual relations as a form of rape. Technically, you can justify it by saying, well, it involves similar hormones, similar movements, so all these sexual relations are forms of rape. You know, what I'm trying to say is that language is not innocent. When you use certain terms to describe certain phenomena, you have to be very careful. There is nothing, no divine law saying that you cannot call this smoke. You can do it by decree, but it is really, it is a perversion of the systems that you are analyzing. It is, and well, it will backfire. Let me tell you, it will backfire because it is completely disproportionate and it doesn't apply. It's not. I don't want to go to technical details, but you can. There is a very precise and rigorous way to define which aerosols are smoke and which are not smoke. And using this definition, many aerosols in kitchens, in cooking, will be classified as smoke. I don't think they have noticed that.
Yeah, thanks for that. So, Maria, you're kind of an enigma in Canada, really, aren't you? With your, I mean, you've been doing this a long time. Do you want to explain how you got into this from harm reduction side and what your activists have been in the past and what you're working on now?
Okay. My name is Maria Papayawanu Duick. That's why I just tell everybody to call me Maria P. So much easier. I started smoking a long time ago. I was 14. I can still remember that cigarette. I can feel the tingle in my fingertips from that nicotine. I was hooked. And I think many people in here probably can remember that feeling. And I tried quitting for many, many years. And it wasn't until 2010 when my mother-in-law, of all people, said, I'm going to take you to go buy this thing. It's like an electronic cigarette. And we're like, what? Are we living in the future? So we went to this place, and from the moment I started, it was a little bit harder for me because the technology in 2010 was very different. But within a year, I had quit smoking, and everyone was like, oh my God, you quit smoking. So we decided to open up a vape shop. And we were one of the first vape shops in Toronto, if not Canada, back in 2013. And I got involved in advocacy because I don't like not knowing. And as a business, and I've like really high and low, if you own a business in this place, you need to know what's going on. There is no excuse to not know what the laws are. There is no excuse not to know what laws are coming up. And in my head, I thought, well, I can't plead innocent because I didn't know about a law. Ignorance is not an excuse. So I said, I'm going to figure it out, because in the city of Toronto, they decided in August of 2014 to ban vaping from all city-owned properties that city employees worked at, but to let smoking happen. So you can smoke, you can't vape. So I was like, oh my goodness. So I went there completely not knowing, and then all these kids showed up and sang a song about dead smoking people, pulling at the heartstrings. And then I watched the city councillors, who I'm happy to tell you 5 years later, they didn't get reelected, ask a vape shop owner what their profit margins were, instead of asking how many people from this, how many Torontonians are coming in and getting help. And then I thought to myself, I will never be blindsided again. I don't want to be stupid, because, you know, sorry, I know that's a bad word, but I don't want to be ignorant. If I'm here opening up a business to help people that are going to trust me, as a business owner at that point, I needed to know what was going on, because I needed to own my walk. I can't just talk. I need to own my walk. So we had this really amazing mayor. Some of you may or may not know him. His name was Rob Ford. He also had an addiction problem, but I called him because he said, call me. And he called me back. And on my first try with my first politician, he kept his word. So I asked him, this is the thing, I don't want you to vote for this. The bylaw went through, but that politician, the mayor of the biggest city in Toronto, kept his promise, and he voted against it. So now, that was 2014, we're in 2024. I still remember that, because I have a choice when I'm advocating. I can remember the people who have said yes to me, or I can be discouraged myself by remembering the people who said no. And you know what? I need all the motivation I can get. It's the yes people. And from that day forward, I've advocated. And a lot of people, and I talk a lot, so you can stop me anytime, but a lot of people said to me, you are going to be discredited because you own a shop. And I said, who cares? People are going to listen to me, the ones that want to listen to me, the ones that are going to discredit me, they're not going to listen to me anyways. I have no chance in hell with those. So I kept saying, I own a shop. I'm not embarrassed of owning a shop. I have access to people every single day. You should be listening to me. I know more than you. And with that confidence, I kept going. And then someone told me, don't be emotional. And then I said, if I'm not emotional, I'm not Maria Papaioannou. I am a Greek woman. Emotions dictate me. Just watch my big fat Greek wedding. That is the truth. So every time someone told me not to be me, I realized that being me was even that more important. So I have advocated. I no longer own shops because I'm so tired of this market in Canada, and I just don't have the heart for it anymore. What I do have the heart for is changing regulations, and my biggest superpower is being unassuming. People kind of don't know what they're going to expect, and they think I'm not very smart, and they think I'm not very quick. But I'm both of those. It's just somehow this doesn't come off like that with them. So I keep doing this, and I keep moving forward, and I'm also patient and persistent. I wanted to meet with Health Canada. I emailed them January 2nd, and I asked them for a meeting anytime between January 3rd and December 31st of that year. No one can say no to you when you give them 362 days to choose from, because then they're not going to want to meet with you. Just keep going. When someone from the other side blocks me on Twitter, I call them. I say, hello, Cancer Society. Why did this gentleman that you pay money for with Canadian tax dollars block me from Twitter? They don't know what to say, but you know what? They know that I'm not watching them. Companies that are funded by Health Canada, these organizations, they bully me. They write something negative about me in the press. I send an email and say, I don't appreciate people bullying me. I am fighting back because you know what? They have had, since 1985, training on how to be mean to tobacco people. And now they're looking at us as tobacco people. So they're using, we're not human, well, I'm not a human, I can't speak for the rest of you, but my anti-organizations don't look at me as a human being, but I'm going to remind them that I am human every single day. So now I don't own a shop and I do this and I love it and it's so much fun. And I love the people who have stopped smoking, and I love people who smoke as well.
If anyone's not inspired by that, I'll be surprised. I wonder why. I'll ask you a question about Canada's COP delegation, because I was at COP7 in India in 2016, and I remember that Canadian delegation worked with the EU and certain NGOs to fight against over regulation of vaping products. Mm-hmm. And then Canada seemed to go the other way. It may have been something to do with EVALI or something, but then they became very restrictive. So what version of the COP delegation for Canada is going to turn up to this one?
I think the version that's coming up for, aside from one person from Health Canada, because I know, but he's retiring, based on the list that was shared to us from Health Canada, shared with me from Health Canada, I think that it's a compassionate group. So I have seen a difference. EVALI really, everyone, oh my God. So the head of tobacco, I don't know, I can't see their title really properly, but that person that's in charge of regulating us really had to clamp down and with external pressure. But as we've seen during COVID and then after that person left and we have a new head, you've seen a bit more compassionate and more aligned with Canada's harm reduction policies when it comes all across. We have a Minister of Health and Addiction. So our Minister of Health and then Mental Health and Addiction. So they've changed. They no longer refer to people who smoke as smokers in Canada. The policy is people who smoke, that is in line with our drug policy. So we're making changes, and I do think it's based on a compassionate moving forward.
Nice to hear. Thanks. And last but not least, obviously, Filip Tokic here from Croatia. You're involved with a consumer association called Chrome, as I understand it. I don't know what it stands for, but do you want to explain all that and tell us about what's going on in your country and how you've got into this whole debate in the first place?
Okay. Thank you very much for coming and for inviting me, of course. Well, I was a heavy smoker, and back then in 2010, I discovered electronic cigarettes. So after 3 packs a day, I stopped smoking completely. So it was like a miracle. Everybody who stops smoking knows how it's hard process to come. And I thought back then, it will be easy. The smoking is the past, and the electronic cigarette will take care of the smoking. Well, that didn't happen. So 2013, when the first TPD came on, when there was the first TPD, we realized that it doesn't go that way. So there was 2 drafts. The first draft was to completely ban the electronic cigarettes, but the second draft, we get what we get now. And then I realized that they don't understand, public health officials, maybe they don't understand what is electronic cigarettes. So we organized the conferences, and the first conference was 2015. It was the first international conference, and we invited Dr. Karl Fagelstorm, and he came to Croatia to the conference, and it was also an invitation for the Croatian public health officers to come, because they saw the Fagelstorm is coming. And since then we made some kind of connection with the health officials, and we keep every year we're making conferences about the harm reduction, vaping, and so on. So I think Croatia is one of the countries that still have chance. We don't have taxation. We have okay communication with the health officials. So that's the 10 years that we are doing right now.
Okay, thanks. Now, obviously, Croatia is in the EU, so Croatia will send a delegation. But at the end of the day, what happens at COP10, the EU basically decides the fate of Croatia, doesn't it? How confident are you that the EU is going to go to this conference and do good for harm reduction? Because I'm not really that confident myself. What are your thoughts?
Right now, when I was traveling here to Panama, the two officials from Croatia travel with the same plane. So we were discussing about, they were surprised that I were going. You know, I said, I'm going with the same cause that you do, some the opposite way. You know? And interesting, one of them was the smoker. You know, but he's using heat tobacco, and he wanted to smoke in the plane, in the toilet. I said, don't go in the toilet. I'll give you the vape. So he was vaping, you know, the whole flight, stealth vaping. So one of the Croatian health officials that are going is was vaping the whole, you know. So I don't know. We'll see. I think they already know what they will vote there or something. So. They don't, you know, the decisions are made somewhere else.
Yeah, I want to meet this guy, I have to say.
Well,
it sounds fun. Yeah, there are kind of rumours that the EU is going to decide to just go its own way and make decisions without referring back to EU states. And I've heard there are a few EU member states who are disagreeing with this, you know, quite strongly. Do you think the EU is going to do that? Do you think it's going to act without discussing it with the EU member states, or do you think they've been pressurized into not doing that?
Well, I have the right information. They will not, because there are several member states that are, there are more than several member states that are not willing to give all the authority to World Health Organization. So I think that plan won't pass so easy. I think, I don't know. We will see what will happen.
Right, we've got a few minutes. If anyone wants to ask any questions, about 6 or 7 minutes. If anyone's got a question, put your hand up. Give me a shout. No? Everyone, you must have done a good job explaining yourselves very well then, I think. Well, I think you've done great introducing yourself, and I'd like to thank all of our panel here for giving their thoughts. Yeah.
This issue of calling this aerosol smoke, there is one guideline that you can use, that any aerosol that is generated in an atmosphere without oxygen is not smoke. This is the criterion too. And it's very simple. You conduct the experiment, and if the aerosol is generated in a pure nitrogen atmosphere, then whatever comes there is not smoke, right? Because you can have a continuum. You can have any material, and if you start putting heat on it all the time, there will come a point that you will produce smoke. When you are cooking, and we cook every Sunday, we have carne asada, we have barbecues, and sometimes my son was making the barbecue and he was distracted, and suddenly, bang, fire, right? So you can produce smoke in anything, but you need a temperature. And if my son would have conducted this thing, what I'm trying to say is that there is a rigorous way to define smoke and not smoke. And what the WHO is saying now would fail the test. And this is something that people have to be aware. It is an extremely and crudely a political definition, and is not supported by what we know about aerosol generation.
Thanks very much. I failed all my science exams, so a lot of that doesn't mean, but I kind of get what you're talking about, but thanks very much.
This is like rewriting the English language.
Exactly, yeah.
To their benefit.
Yeah.
Yeah. Anyway, thanks everyone for this panel, and that's another 4 of our experts introduced. So thanks for everyone for watching, and we'll be back at 2:30, I think. Yeah, 2:30 with our 3rd introduction panel. Thanks very much.
I think we are happy.
If it's burning, nobody would eat that. It's the same thing. If I'm vaping and I go into a dry puff, it is technically smoke, but nobody would vape that.
Oh, we have to take a photo.
Este sí te llega. 2. 1, 2, 2, 2, 2. Ese te llega. Y ese yo lo bajo y este ya está llegando ahí. Ahí te está llegando. Estamos bien. Mi pregunta es, ¿por qué si yo el 6 te estoy mandando?
El 8 tampoco. Nada. El 8 sí. Chaquicueca, huevo. 2, 3. Ahí sí te llega bien, ¿eh? En el 8 entonces. Ok, entonces el 8. Churun, churun, chun, fly. Churun, churun, chun, fly. Churun, churun, chun, fly. Sí, 2, 2, 1, 2, 3, 1, 2, 3, sí, aló. Sí, 2, 1, 2, 3, 1, 2, 3, sí, aló. Y. ¿Qué tal? 2, 3, sí, aló. ¿Muy alto o? Ahí está bien. Ya sabemos que el 8.
Yep, it's live.
Welcome back to Good Cop. And we're at the Central Hotel Panama in Panama City, and couldn't be more excited to be here with tobacco harm reduction advocates, doctors, consumers, taxpayer organizations. And it's the first day of the conference, and a lot of energy, a lot of energy. I know you weren't expecting to see me right now, but there's been a slight change in plans, which is fine. It happens. And we want to roll with the punches here. And just want to mention that the World Health Organization actually never had their live stream this morning. I don't know if it was incompetence. I don't know if it was because they were afraid to show the live stream. But that being said, here we are. We're live and right at you. And we want to talk about North American tobacco harm reduction. Listen, this is an issue that's obviously happening around the world. There are, 1.8 billion smokers, I think. There's a lot of people that are smoking around.
1.3 billion.
1.3 billion smokers. And what we're trying to do is bring awareness to this issue, whether it's from a taxpayer standpoint, a consumer standpoint. And right now, for the next few minutes, I want to focus on North America. We have Lindsay Stroud, who is the expert in the United States.
Yep.
Has done 50 state analysis. It's amazing the work that Lindsay has done for the Taxpayers Protection Alliance. She has looked at the numbers every year. She puts together these numbers, and it takes a lot of time, a lot of editing by Patrick Hedger, who is our executive director, and myself. But it's worth doing because these are the real numbers. This is what's happening when it comes to smoking, to vaping. So excited to hear more from Lindsay about what's happening in the individual states in America. But then want to introduce a friend of ours, Maria P. From Canada.
Yeah.
And so glad that you're here because it gives another perspective on North America, what's happening in a different part of North America. And I know that with a socialized healthcare system, you really have a different perspective on what this means, what it means for taxpayers, consumers. And, Maria, the first time I met you, your energy was off the charts.
Oh, it always is.
And
It
I love to see
always
that.
is. It always is. I just, you know what? Yeah, but then when I go and I'm all alone, I just recharge.
Well, let's kick it off to Patrick. But Patrick, before you get started, again, I want to thank the Central Hotel of Panama. They have done an amazing job helping us put this conference together. I want to thank the National Taxpayers Union, the Tholos Foundation, Americans for Tax Reform. But Patrick, the Taxpayers Protection Alliance, obviously, we protect taxpayers in an alliance. So talk about that aspect of tobacco harm reduction and your perspective and the organization's perspective when it comes to taxpayers and the spending.
Yeah, absolutely. It's a pleasure to be here doing a lot of work behind the scenes, but it's a pleasure to speak to why our organization in particular cares so much about this issue and why we work on it so extensively to the point of putting on a conference in a different country, which was no small task, and there's a lot of folks out there that contributed to this, and thank you to all of TPA's staff that helped out here. The reason why an organization like ours cares about this is, well, there are the obvious reasons that, again, 1.3 billion people worldwide are still people who smoke, and these are people that will develop health problems because of that, and that will contribute to the substantial number of deaths of those people, premature deaths, and that's a horrifying tragedy that can be solved with existing treatments and existing technology. We can solve that problem, and we can significantly improve the health outcomes of billions of people worldwide. So beyond that, you shouldn't really need a reason to care about this issue. But from a taxpayer perspective, especially looking at it in the United States is dealing with right now a debate about the future of the fiscal policy of our country, because the United States right now faces a historic debt to GDP ratio. Our debt levels in the United States rival that of when the country exited World War II, and that is an unacceptably high level. We're dealing with inflationary pressures as a result of the tremendous amount of federal spending that's going on and borrowing that is going on that has raised interest rates. But the picture of the U.S. federal debt at $33 trillion is an incomplete picture, because there is what we call unfunded liabilities to U.S. programs such as Social Security, Medicare, and Medicaid. These programs, for those that aren't familiar, and to those that are watching from an international audience, many assume that America doesn't have free health care. It has free health care for a substantial amount of the population, not the entire population. But for elderly Americans and indigent Americans, there are Medicare and Medicaid, respectively. These programs, we can project out how much will be owed to them and how much is getting paid in over a population over time. And the projections right now, based on the population of the United States, show that Medicare and Medicaid have unfunded liabilities to the tune of tens of trillions of dollars. We are talking about numbers that rival the GDP of the planet. There's just not a tax base there that you can close that shortfall. So we've got to figure out how we can begin to improve public health outcomes so that folks who are on Medicare and Medicaid are not as dependent on those medical services. And the big issue is that people who smoke are disproportionately older and disproportionately less well off compared to a random sample of
And
the
those
population.
services are more expensive. When
Yes.
you talk about cancer and you talk about those sorts of things, that healthcare is so much more expensive than,
Yes.
yeah.
We are talking about resources. We're talking about cancer treatment resources and drugs, treatments for emphysema, treatments for heart disease, all of the accompanying harms of combustible tobacco that occur, that are caused on the population, caused on a person. Those are very healthcare intensive resources and very intensive expertise. So to the extent that we can free up those resources, that will make those programs not only more affordable, but also able to serve a lot more people as well. And frankly, it's just a little crazy in the United States when we are facing this kind of, huge fiscal cliff, if you will, from our unfunded liabilities, that we aren't taking an all-of-the-above approach. When I first started studying this issue, it was insane to me that in developed countries like the United Kingdom and Japan, they have, where, again, there shouldn't be a major difference in the healthcare science between the United Kingdom, Japan, and the United States, but there is on this issue. And we are leaving a substantial amount of resources on the table, and that is, that will cost lives of people who do not smoke, because those resources aren't available in the long term for conditions that they may develop unrelated to their habits, unrelated to consumption of cigarettes. So there's a real moral problem with taking an approach that doesn't do all the above approach to harm reduction, not just for the people who currently smoke, but people who are dependent on social safety net programs, not just in the United States, but particularly around the world, where you do see more single-payer socialized systems that tries to cover the entire population.
Yeah, and I want to just piggyback onto that and say, for taxpayers, obviously, the healthcare costs, but remember, taxpayers are funding the World Health Organization. Taxpayers are also funding the United Nations. I urge everyone to contact, their government to find out how much of their tax money is going to the World Health Organization and the United Nations. Remember, the World Health Organization is a sub-agency of the United Nations and doing really bad things. Now, let's talk to Lindsay about the numbers. You look at the numbers, you look at teen vaping, you look at cigarette usage, you look at all the numbers, who's smoking, who isn't smoking, break down the income levels. What have you seen? Because obviously there was this big uproar a number of years ago about EVALI. That was the big boogeyman that hit the United States.
It was illicit vapor products that caused that. And what do they keep doing? The same policies that will create only illicit vapor products. But yes, so the 50-state analyses, everyone probably knows it, and if you don't, go check out my Twitter or go to protectingtaxpayers.org. It's right there. But this is a 4th edition that we've done. I still think it's the best one yet, but I say that every year with it. But it's just an analysis at the state base that looks at smoking rates and vaping rates among adults. Actually, we were instrumental in getting them to publish the 2021 numbers on that. Remember when I was trying to compare e-cigarette use, and you're like, well, where's the numbers at? I was like, I don't know. The CDC wasn't publishing it. It's easy to access data. It's just aggregating it and putting it together and then putting it into a way that well-meaning lawmakers that can understand and read, including a lot of graphics, because they definitely need charts. And What have I seen? I've seen a lot. I started looking at these numbers because I wanted to counter this argument that youth vaping leads to smoking. If that's the case, you'd see a lot of smoking, especially among 18 to 24-year-olds, and at least here in the United States, that's at the lowest level it's ever been. It's actually, I do a chart on it, and it's kind of amazing to see the dramatic decline in these smoking rates among young adults from especially like 1995 when like 30% of 18 to 24-year-olds were currently smoking. I think my latest number for the aggregate of the United States, I want to say it was like 8%. And in some of these states too, it's amazing. There are less 18 to 24-year-olds smoking than 65 plus, which is if you're looking at smoking rates in the charts, those have kind of 65 plus has always kind of remained pretty stable. It's actually, you're starting to see an increase, and that's going to be interesting to look at over the next few years, going more through the BRFS to see why that is an increase in 65 plus smoking. But some other interesting things, you can see from this data is looking at the effects of, flavor bans. And so I know like right after in 2020, you actually saw an increase in smoking rates in 3 out of the 4 states that had enacted a flavor ban, especially among young adults, which is kind of alarming. Now, it was only a 1-year increase. Unfortunately, it went down in 2022, so it's not as high. But again, I think you'll be able to see some of these real population data. But it's just so alarming. I've been able to now look at how many adults are vaping, and it's like over 20 million American adults are using just BRFS and population numbers.
That is CDC data.
That is CDC data, yeah.
Yeah, that is CDC data.
Yep.
So that we're
It's
not
over
gathering
22
this data
million,
ourselves.
yeah.
It's publicly available. You can check Lindsay's work on this. This is not any sort of closed, inaccessible data that we're using. It's publicly available, taxpayer-funded CDC data.
Yeah. But still doesn't make up for how many, it's like 100 million. So I don't know how many smokers there are. Or people who smoke, sorry, Skip, that are out there. There's a lot more people and a lot more adults that are using cigarettes, unfortunately. But you can definitely notice when you start to compare smoking among youth. I mean, that's also been eradicated too. Most states. I know I was just looking at Hawaii for every one kid that was vaping in Hawaii in 2021, high school student, you had 73 adults who were smoking, right? Yeah, for every one kid that was smoking, you had more than 73 adults that were smoking. For every one kid that was vaping, they actually had a pretty high number. You had 10 adults vaping. I know for the United States, for every one kid you had vaping, you had like 6 adults vaping. And I think you have about like 60 for like adult smoking. So we still need to get that number down. And I think that's what's really annoying. You definitely can see it around the world, but it's definitely in America. We've lost, we don't care about the people who smoke. And we still pushed out these, draconian measures, including excessive taxes on people who are disproportionately harmed by taxes. If you go to any state, the person who smokes, on average, is going to be a white adults, usually between 25 and 44 years old, and they're going to more than likely earn less than $25,000 per year, and they're more than likely going to have a lower education. So those are the people that we should be protecting, and looking at those numbers and looking at the ways that we can reduce the burden, whether it is tobacco harm reduction options. I mean, just even information, I think, would be nice in America, but it's all misinformation.
The tax data shows that in many states, with the levels of taxation, you've reached a point where it's not deterring any more smoking.
Yep.
You have people that are addicted to the point where they will access it by whatever means possible, whether it means dipping deep into their own pockets or going to the black market.
Yes, well, I mean, that's in the analyses. We do look at the effects of excise taxes and all the among lower income people compared to higher income people. And yes, you do not see dramatic increases dramatic decreases after tax increases, especially among lower income, lower educated people. I'm still waiting for my hypothesis to not work in any of these states, and it still works on all of them. And I don't have to tweak my numbers, which the opponent organizations will do in their own data.
So Lindsay, I'm going to ask you about California in a few minutes, but I want to hear from Maria. I want to hear about what's happening in Canada. You were telling me some great, not so great stories about about tobacco harm reduction in Canada. So please give us a primer.
At the end of the day, harm reduction is protected under our charter. And there is nothing more powerful than, I think, a country's charter, and a country that respects the charter. Sorry, you got to have both. The government that respects the charter. And in 2010, there was a charter challenge for safe injection sites. And it went through, and yes, harm reduction is a choice, and Canadians have the right to choose how they deal with their addiction. So when you look at Canada, we recently, and I think it was about 3 years ago, we have a Minister of Health, and then we also have a Minister of Mental Health and Addiction. This year's Minister of Mental Health and Addiction, I have no idea why she's there. I just think it's just a place filler. But the previous one was absolutely incredible. And playing upon that is that what we've done and what I've done is like, hey, walk your talk. You cannot in one breath tell everybody that nicotine and smoking is the most deadliest disease in the world and then not offer the same options as you do with other deadly drugs. So my goal was always, let's align the thinking at the governmental level. And then I thought naively that the ants, or I like how you said that, your opposition, our opposition, well, I call them the Tres Amigas.
Public health trade associations is what I've been calling them lately,
okay.
too.
Well, I call them the Tres Amigas. I just call them nicknames of the heads, like Andy, Robbie, and Cindy. Anyways, I just nicknamed them. But I thought they would kind of understand and get it, but they doubled down. And you see that what's happening is the more that our federal government is saying, okay, let's look at the science, and you can see the changes in Health Canada on their website. You can see that Health Canada is bringing in lived experience when it comes to people who smoke, which they do with every single other addiction and mental health. So they align that, and I give them kudos. You can't, like, you have to say, thank you. Thank you. But then I feel that our opponents are now at the provincial level, where the provinces are having that opportunity to double the excise tax, to ban flavors. I don't know what money they're making from, they ban flavors on the excise tax. Like, no one's buying tobacco, let's be honest.
Are there any checks from Bloomberg that go to these provinces?
There is a rumor that one of our major political parties, that's in, I don't know, a relationship with our current government, may be being funded quietly by Bloomberg dollars. And you can see with their policy, they have a policy that they won't talk to anybody that is pro-vaping. They have a very, very, and I don't know, like,
So they
come
wouldn't
on.
talk to Public Health England, huh? That's
Yeah,
a shame.
but I guess I hate to say the pro-vaping. I mean, at the end of the day, we're talking about human life. And we turn addiction into something that's an ethical or a moral issue, but it's not. It's an illness. And when I think back to this industry and how it was built, and this is back in 2014, going to the trade shows and meeting these people, so many people, some of the biggest e-liquid manufacturers were in recovery at that time. I can't speak to what it is now, but this industry was not built by Big Tobacco. Juul showed up. I don't know what they were doing in that part where you guys do all your tech stuff, San Jose or whatever it's called. But this industry was built by people who smoke, understanding addiction in a way of lived experience. And now the entire narrative was switched around that Juul created this, and that really angers me so much because I've met people from the United States and England who in 2013 were trying to make this better. And in Canada, we were trying to create better regulations, not because we necessarily knew what was happening, was because if you're making harm reduction, if you're making a safer product, why not make it safer? And it's all about making it as safe as possible. And this is because we were using the product we were making. And that made a big difference. So we have a lot of work to do on the provincial level. Our body part organizations, I have lots of names for these people.
Body part orgs, that's, yeah.
The body part organizations have like a hate on, for lack of a better word.
Yep.
And it's as if Big Pharma is funding all this. And I know I'm putting on my tinfoil hat at the moment, but who makes the most money off of people who have long-term, long-term illnesses that can be not cured, maintained, because you can't cure your illnesses from smoking, but you can maintain your illnesses from smoking with drugs that the pharmaceutical companies have. And if vaping is reversing some of this stuff, and I think it is, I'm not a scientist, but I can just look at my husband and myself, we don't need those medications. Like, cancer is a business. The Cancer Society makes money. I don't know. Like, I know I'm not shocking anyone, but all these organizations are businesses. They need to be in the business of people being sick. The easiest people are the mean, ugly, sorry guys, the dirty, smelly smokers. I'm one of them. So they need us smoking.
In the United States, we're seeing a growing problem with illicit disposable vapes, right? We're seeing more.
Well, all vapes are illicit, except
Well,
the
true.
23 authorized ones that
Yeah.
the FDA's, gave the
Is
go-ahead
Canada
for.
having the same issues? Are you seeing the black market, or?
We're seeing an increase in the black market because a lot of shops don't sell to kids, number one.
Yeah.
People follow that. Like, a lot of the provinces have very strict regulations on that. And the other thing is our nicotine has been lowered to, I don't know how do you guys do 20 milligrams or percent here?
We do percent, but actually we do, yeah, but
so
yeah,
20
milligrams, yeah.
So we can't sell anything over 20 milligrams or
Grams, yeah.
2%. So the black market is starting to bring in 5% or 50 milligrams. And those, again, I have no idea how you're going to regulate Snapchat and TikTok and Instagram.
Don't give them ideas. I work on that issue as well.
Yeah.
But how you sell it, like, trust me, we're regulated. Like, we can't see news on our Facebook feeds. So anyways,
that
but
might
we
be a
can
good
see
idea.
someone selling vapes in a local Facebook group, but we can't get the news on social media. So yes, we do have a black market. We also have a market that is on indigenous lands, because they're not, and I don't think they're doing anything wrong. I don't want to start anything. Like, I mean, it is what it is. They can't regulate on indigenous lands.
Yeah.
People want what they want. And the fact is, this product was not created by a tobacco company. It was created by people who wanted something that was better. And they need to stop trying to shut us down and shut us up, because we're not going anywhere.
I think what you just said there is a point I wanted to make. Something that's better. It's not a perfect solution. And I think that's something that really gets lost in the conversation about reduced risk products. It's not a cure. It's not a perfect product. There may be negative consequences of these products. But we cannot make perfect the enemy of the good, especially when we know the dangers of cigarettes. We know the dangers of those other products that are out there, especially illicit products as well. We know those unregulated illicit products that contain THC that are getting confused with the nicotine products are causing harm. So we cannot make perfect the enemy of the good, and I'd like to quote one of my favorite economists, Thomas Sowell. He says, "There are no solutions, only trade-offs." And the problem is right now that we have global regulators, and particularly in the United States, at FDA all the way up to WHO, that are trying to regulate for a world that does not exist. They are making perfect the enemy of the good, and they simply do not seem to acknowledge the trade-offs. They are pushing a strategy that, based on the data that I've seen, works for 6% of people who smoke. 6%. So that is by no means would that be an acceptable public policy anywhere else. Imagine if you had emissions targets that were only 6% effective, or any other kind of public policy in place that's only works 6% of the time. It would be, well, maybe not in the case of the United States, but in a lot of places it would be scrapped. There's a lot of public policies tend to have a lot of momentum, even if they're terrible. But that is the paradigm that I think is really missing here, is that nobody is trying to say that people should start using these products if they are not already addicted to cigarettes. What we are trying to say is that we need to have that space that's available for people like yourselves. You talk about it, again, it's a grassroots industry. And it is not being acknowledged that way. And then the tobacco companies, when they are entering the industry, they're being treated as if it's the same people that are working at those companies that were 100 years ago. And that's not the case either. So I think there's just a lot of momentum against the idea of anything derived from nicotine. It's logical because of the horrible experiences globally we've had with the cigarette trade. But there's just a lack of acknowledgement about what's really happening, and it's concerning.
Can I say, like, when I've been advocating, like, based on what you're saying, lots of horrible situations. So those people that keep telling me there's lots of horrible situations, not you, like, and then when I say, and their answer to me is, we get it, you vape. And what I want to turn around is, we get it. Someone got screwed in 1985. Let's move on. Because if you are still living in 1985, you're rehashing a story that you heard from a friend of a friend, and that story is so mutated at this point. Get over it. Be stronger, and don't lead with fear. Don't lead with ignorance. You're choosing to be misinformed. You're choosing to avoid putting me in a room with you because the WHO, which is not the band, which I thought it was for the longest time, the World Health Organization makes decisions. The World Health Organization, emissions, we're going to have better emissions because they invite the car manufacturers to their COPs.
Yep.
Yeah.
They're going to have better solutions because they invite the people who not only use the products, but the people who create the products. Over here, they're so afraid of their own shadow that they need to just grow the F up. And I don't know why.
And that's
Well,
the
to that
final
point,
Am I allowed
well,
to
actually,
swear?
to that point, no, do not
Okay.
swear, please. With that point, though, I mean, right after Conference of the Parties, they're going to have the MOP, that's the illicit tobacco, and they don't invite even the tobacco manufacturers who, you know that they know about illicit products. There's all these counterfeit products that they're trying to get off so they can go to the WHO. Hey, we've already seen an uptick in, our cigarette sales just went down exponentially, and we don't know why. Well, yeah, obviously you're going to know why. It's not like people just completely, smoking has ever just, fallen really flat, really, abruptly. So they're still not invited to the table, even though they might have some insight in how to, combat illicit trade.
They know. It's like trying to, not inviting Louis Vuitton over for the fake purse industry. They know what their fake stuff looks like.
Yep.
I mean, it'll be harder to fake cigarettes because you have to write entire shame messages on our cigarettes in Canada now.
And then when you have regulations like America, I mean, Canada's pretty free when it comes to,
Weed?
vaping. No,
Oh,
well, and that
okay.
too. Yeah, we still have a federal prohibition on marijuana in our states. But, the regulations in America are so draconian, so closed off. Again, 23 products have been authorized. Pretty much every vapor product that adults are using, there's 22 million adults are using illicit products because the FDA refuses to recognize
Well, and not only
flavors.
that, the FDA set up a system, a process to do this, and they're not using it.
Yeah.
I mean, they have a way of doing this. There is a path forward for these products, and the FDA has chosen not to use that. And listen, the Food and Drug Administration
Worst agency
is the
ever.
gold standard of the world. When something happens at the FDA, the
Yeah.
rest of the world listens. That's why we're so concerned about what's happening at the FDA now. I promised you I'd ask you about California.
Yeah.
Because what we have seen in California, and I'm curious if this is happening in any of your provinces where they ban flavors, and what you do is you have people then swing back to combustible cigarettes, which completely is counter to what they're trying to accomplish. So
Well, California, too, they had the study. I mean, yeah, you saw a slight increase in smoking. Again, it didn't last super long. And even prior to them doing their statewide ban, most of California was already under local bans. If you're looking at the CTFK probably does it, in your country, too. You go and get the localities first, then you could get the state, then you get the whole entire United States. That is their plan. That is what they do. And it's very smart and effective to get their stuff done. But California only saw, even on reduction in, menthol incidents based off of the study that was done, where they collected trash and cigarette packs, and it only looked like a 12% reduction in menthol use. But there was also the workarounds. You had a lot of foreign cigarettes coming in. You had all the cross cigarettes too, and all this stuff. So the bans don't work because they don't address, again, the consumers, the people who are using these products, why they are using these products. I always look at youth vaping. I think is the best one. We keep going after flavors. Yeah, in America in 2021, it was 43.4% of kids who were currently using e-cigarettes cited to use them because they were self-medicating because they were feeling anxiety, stress, and or depression. And it's alarming to look at what the mental health crisis kids are going through and not addressing that, but just going, oh, no, it's big tobacco coming after our kids and everything, when big tobacco was actually forced to change their products. And I think it's amazing. Government's been trying to do stuff, to the tobacco industry for how long, and you still, it wasn't until this consumer-driven revolution got them to change their products to e-cigarettes. It's not like the government is mandating them to make safer products, even though we're mandating car manufacturers to make safer products. I mean, but it'd be like what we're telling tobacco companies is like, oh, you can't make, you can't make a smart car. You can only make a diesel fuel engine, and because that's what we know and everything, and we don't know the long-term effects of this. It's just quite amazing.
That gets at the irony of the World Health Organization and other bodies shutting out industry, yet they create regulatory standards that only the established industry can comply with. The process of getting a drug through the FDA or getting a tobacco product through the FDA is enormous. I believe for the IQOS product,
$8 billion for all of it. We even getting the
$8 billion
modified
total.
yeah, for
I
the
believe that
MRTP.
they submitted over 2 million pages of paperwork. No small upstart, unicorn company, right, that you talk about in Silicon Valley. No investor would ever put money into that process, and that's a huge problem. We've got to lower those regulatory barriers, as counterintuitive as that may seem. And finally, I wanted to wrap up my remarks on this panel addressing the final reason that I didn't get to about why an organization like ours cares about this and is down here in Panama to have this panel and have this war room and have these live streams with all of you, is that the World Health Organization is disproportionately funded by countries that have liberal democracy, that have liberal democratic values, all to varying extents, but we all strive for those values, and we are the ones disproportionately funding the World Health Organization. But to have a conference, an international conference, where the media and the people impacted by the policies you are deciding on are left outside the door is unacceptable. And that does not align with liberal democratic values. You could think everything we're saying here at this conference or throughout this conference and throughout this week is wrong, but you can see us saying it. We're right here. We've got consumers in the room. We've got journalists in the room. We're ready to be challenged. And that's what the World Health Organization should be doing. And I think it's very telling that they never got around to the only public part of their conference today. Never happened. And I think that it's just an absolute shame because we have to have a conversation. We may not be entirely correct about our position here. We're willing to acknowledge that. But we're at least trying to have the conversation because something has to be done about this problem.
I want to say something.
Well, let's do this.
Oh,
so we're nearing the end, and kind of like in a debate where you have 2 minutes to make your closing statement. I pretend you're in front of the World Health Organization, and I know that the delegates have like 2 or 3 minutes to speak. So starting with you, Maria, you have 2 minutes. You're in front of the World Health Organization. You're not using profanity, but you're in front of the World Health Organization, and you are sending a message. You have 2 minutes. I'm going to time you, okay?
Okay. Dear World Health Organization and its members, I am going to say one thing. If you are really about World Health, I need you guys to check yourself and ask yourselves, why did we ban a vaccine just because it was created by a tobacco plant?
Yeah.
Let's think about that. How much do we hate tobacco that we're willing, that you are willing, and I don't know who you are, willing to put my life on the line? Because you hate something that happened in 1985. You hate an entity. You hate a billion-dollar corporation. Get over yourself. I didn't ask you to be there. I asked you to sit with me. I've asked you guys to help let me be part of the regulation. And every single person that is watching this right now, and if your country is at COP, I want you to write an email to your Minister of Health and ask them to tell you why they chose not to do the opening ceremonies live. Your tax dollars sent you there. So who? We're going to get you because some of us live in a democratic country that our governments don't always listen to everything you say.
Fantastic. Less than 2 minutes. I love it.
Thank you.
Lindsay, you have 2 minutes. Strict 2 minutes.
I can go less than 2 minutes.
Oh,
okay. Dear WHO, Michael
No profanity, remember.
Michael Bloomberg is not a god. He's just simply a guy with a lot of money, and he seems that it's all well intended. But just like you hate tobacco, he hates it too. We definitely know where you're getting your mantra from. And Oh, actually, when you make up the point on that, start listening to the consumers. If you really care about the adults who smoke and you really care about reducing smoking rates, it's time to listen to the consumers. It's been more than time, okay? The consumers have been doing this, I know, in the United States. CASA got started back in 2009, okay? These are adults who have now been smoke-free for over a decade due to these products that you think is just a wolf in sheep's clothing, and then it's just designed for the 8-year-olds that you always talk about. Correct. It's time to start talking about the 40-year-olds who are still smoking.
1 minute exactly.
Yeah.
Thank you.
I do a lot of state testimony. Okay, I
Yes,
get it
that's
down in
true,
2
that's true.
minutes.
Maria, thank you.
Thank
Lindsay,
you.
thank you. Patrick, thank you for this
Thank
off
you.
the cuff sort of
Pop-up.
panel
It's a
where
pop-up.
just,
It's a pop-up panel.
a
Right,
pop-up panel.
I want
Yeah,
to address the people that are watching on the live stream. We will have another panel at 3:15 and another one at 4 o'clock. Things have been fluid here the first day.
No, we don't have a panel at 4.
We don't have a, well,
No,
see,
it's
there-
regulator watch. We were done with the
Excuse
day
me.
at 4 p.m. for everybody
yes,
here.
we have
okay.
another panel starting at 3:15. We have some other programming that we're doing internally here, but we will start again and get back on the agenda tomorrow. Things were thrown for a bit of a loop today, again with the World Health Organization not upholding their end of the bargain and having their public presentation. So we thank everybody for bearing with us as we figure things out here, but that's why we're calling it a rapid response center. We've got to be able to change on the fly. So looking forward to our next panel at 3:15.
Awesome. Thank you.
Thanks. Oh my God. Okay, and why it was on the pop-up?
It's actually easier when he does it. My hair doesn't.
So I'll just go like I did last time, just along that way. Is that okay? Ready? Right, hello everyone. We had a slight change in the schedule for the last panel. That was kind of a pop-up panel, but now we're back to the expert introductions again, and I've got another 4 great experts here for you. Lisa from Georgia, that's right. Georgia, Thomas from Mexico, and Jeff and Grant from the USA. So we'll go along the line as I did last time for the one I did before. Lisa, you're WVA, World Vapors Alliance. Do you want to tell us how you got into that and your work with Michael Landau, obviously, who's whatever his role is, head of the WVA, and like with Alberto, you just tell us about what some of your globe-trotting, some of your campaigns, what you've been getting up to.
Absolutely, it's a pleasure. First of all, I would like to thank TPA for giving us this opportunity to be here today and for consumer voices to be heard, because as far as we are aware, WHO does not want them to be heard, so we're here for that reason. My name is Lisa, I come from Georgia. I started to work with WVA 3 years ago, and it's been a pleasure because we've been working with a lot of tobacco harm reduction advocates, a lot of people who are passionate about vaping, and right now WVA has up to 60,000 members who are vapers, passionate about the cause, who want to support us, and also get updates about policies worldwide. And also we have 35 partner associations. These associations are also represented at the event and will be, I know some of the representatives will be speaking throughout the week. Those are very dedicated activists who stand for tobacco harm reduction in their countries. They know how governments are implementing very counterproductive policies. And it's a pleasure for us to work with them and collaborate with them and have a chance to unite to defend this cause. And as you said, we, as World Vapors Alliance, are working on different campaigns. We're very active in media, and we also do local campaigns, in-person campaigns on ground. And we also do the podcast, by the way. If you haven't listened to it, you can check it out. So we are trying to be very active and most importantly make sure that the consumer voices are being heard and that policymakers know that vaping is an issue that is important to us and they cannot simply just neglect it.
Yeah, it's interesting to say that, 60,000 consumers and 35 partner organizations. And I know your content on your videos is prolific. You know, I think I've done 3 slots with World Vapors Alliance, and you get a wide array of people from all over the world, don't you? I'm going to ask you this. Do you think that's why you're getting a hell of a lot of heat from the other side? You know, you have quite a few attacks on you for smears. And do you think that's because they really haven't got a lot left?
Yeah, I mean, probably. Isn't that logical? If you're doing a job and if you're making an impact, then probably you're going to be hated by the groups that are anti-vaping. So we always say that if we're getting so much hatred from that part, it means that we're making an impact. We're actually spreading the voice of consumers and we're actually achieving something. So I would say that's happening solely because of that reason.
Yeah, absolutely, and keep it up. That's what I say. If you're annoying them, you're probably doing a great job, I say. So.
Thank you.
Okay, Thomas O'Gorman, do you want to tell us about yourself? I understand you're a lawyer or something, is that right? Or that sort of thing?
Yes, I am a Mexican lawyer.
Yeah, okay. So do you want to tell us how you, from your background, how you get into this fight and what you've been doing in Mexico and beyond?
Yes, well, the thing is, I am a lawyer, and my work has nothing to do with harm reduction. My breadwinning work. The thing is that I quit smoking around seven years ago in 2016, and I never pictured myself quitting smoking. I was convinced that I was not going to success at it. Then I met vaping, and almost without wanting to quit smoking, I was vaping, and I quit smoking. And I realized that this was an enormous opportunity for people like me, and I got a little bit mad about the misinformation and about the prohibition that was already existing in Mexico. So that's why I decided as a consumer to try to advocate for something that I know, I am certain, that will help millions of people, not only 17 million smokers in Mexico, but 1.2 billion people in the world who is actually smoking. And the worst of all is that most of them, 80% of people who smoke in the world are living in low and middle income countries. And those are precisely the people that would benefit the greater if governments take a positive stance towards tobacco harm reduction and understand that these products are not a danger, not something to be scared of, but an opportunity to help people if they are properly regulated. And a proper regulation requires listening to the people, listening to the science, and having some empathy. And most important, to remember that the original goal of the anti-tobacco movement, the foundation of the FCTC is to reduce the diseases and deaths caused by smoking, something I believe they forgot a lot of time ago. That's just the motto, but they don't care about the people.
I want to ask specifically, because you're someone I know went through the process. Obviously, this year, for the first time, the COP, the FTC has required members of the public to apply 60 days in advance. Now, you went through the process, didn't you, along with some other consumers, mostly from Latin America. Tell us the process that you went through and what the result was for all of us.
Well, it was different in Geneva. In Geneva, you just have to file for your application and then you were admitted, and minutes later we were kicked off. But this time they changed the procedures, and as you were saying, as a consumer, you had to ask or to present your application 60 days prior of the event. So we were obligated to do this before or in September 21st. You have to use the same system everybody else. It's called the UN accreditation system. UN, beware of who is using your system. And as a consumer, you had to put, of course, your personal information, your photo, your passport information, and you have to upload your resume saying what do you do, and you have to state your affiliations of the last past 5 years. They also wanted you to present a letter of intent, and then, well, you made the filing, and then nothing happened. No answer at all before November 20, which was the original date set for the COP. And then a couple of weeks ago, I received an email where they were saying, the secretariat of the CTC was saying that because I didn't meet the criteria set for the decision, I don't remember now the number of the COP 8 decision that established this, I was not accepted as public, which is kind of worrying because by definition, public is everyone. So if I am not everyone, what are we?
I think what's so worrying about that is it's completely different to any other UN organization. If you look at any other organization run by the UN, if you want to see one of their meetings, you just apply to see one of the meetings. They say, what's your name? What meeting do you want to go to? And then you'll say, and why do you want to see it? And you just say, because blah, blah. And they'll say, there you go, come along, we've got your name on the door. And it's literally that simple. But the hoops you have to jump through just to make the application is astonishing enough. But yeah, I saw your reply, you showed it to me. And it was the same one, exactly the same one that every consumer got, wasn't it? And it spoke about a decision made at COP 8. And the COP 8 decision was basically that people to do with FCTC will have to take heed of Article 5.3 when they're making their decisions. So basically what they were saying, that all the consumers who applied to go along were industry, even though they're not. But this is how they do it. They say, because you are arguing in favor of vaping and because the tobacco industry make vaping products, so therefore you are helping the tobacco industry, and that's what they're doing. To call out so many people, members of the public, as basically acting in the interests of industry and therefore being industry is really quite scandalous, don't you think?
I actually think it's a breach of human rights. one human right that is being violated by the FCTC, among others, is the right of consumers to a meaningful and equal participation, because we are people that are subject or will be affected by the rules and by the policies that are designed within the FCTC and within the COP. So therefore, if consumers are not allowed to have a say, our human rights are being violated. But the worst thing is that we are not even allowed to be present. There is no scrutiny that can be made about their proceedings. They are considering us pariahs or something because we are not even allowed to be there. It's like if they consider us like some kind of infectious people that will contaminate the purity of the tobacco control members. I mean, it's amazing that media and other organizations that tend to protect human rights are not mad at these people. The UN should not allow them even to use their INDIC or their accreditation system if they are using it to discriminate consumers and other persons that wanted just to be there. I mean, we just wanted to be there, and we were not allowed. I have already paid for my trip, so I changed the tickets, and here I am. But this costs me money, and they don't care. They don't care.
I can see you're very passionate. Now I'm going to ask you another question. I was going to ask Roberto this, but he was too fascinating about smoke and all that sort of thing for me. But could you tell us what's happening in Mexico? Because products are banned in Mexico by presidential decree, is that
Yes.
right? But there is people who have been telling me that once he might be out of power, then maybe something might happen in Mexico. Can you give us an idea of what's happening there?
Well, in Mexico, currently vaping is prohibited by two different rules. One contained in the tobacco law, which was considered unconstitutional by the Supreme Court of Mexico in 2021, and then a decree issued by the president where he prohibits the commercialization and the imports and exports of the products. The thing is that in Mexico, we have some kind of trial called the Amparo trial, which is a remedy that the citizens and the companies have in order to ask for a certain ruling, or for a decree in this case, to be declared, if it's the case, unconstitutional. And the thing is that some companies have already won the Amparo trials, and then legally, they can legally sell these products. Use is not forbidden, and the thing is that the government still insists in banning the products and misinforming people about the risk, because the only way to sustain a prohibition is to deceive the society and tell them horrible information about these products in order to get some validation of a prohibition.
Great, thanks. Personally, I think Latin America and South America is going to be very interesting in the next couple of years. There's lots of things happening there, so I'll be watching Mexico as well. So on to Jeff from the USA. Do you want to tell us, you told me yesterday you're a scientist, but do you want to tell us what other skills you have apart from that, and how you're here and who you represent? And that's
yeah, it's been really interesting listening to the panelists this morning and this afternoon. And if you haven't yet watched those videos on YouTube, I encourage you to click back and listen to them. There's a lot of really interesting backstories as to how people came into this world of being advocates for tobacco harm reduction, and my story, I think, is a little less interesting. I, like many people, have a grandmother who smoked her entire life and died of lung cancer attached to an oxygen and smoking through her throat. But that really wasn't the impetus for that's probably one reason why I never chose to smoke. But it really isn't what brought me here. What really started my career was really, I had a friend who had a spinal cord injury, and there was nothing to do to mend the problem, to fix the problem. I was always waiting to see what could happen, and saw all the changes in his life and his family lives, and it kind of led me into neuroscience. And so I spent 20 years of my academic career trying to understand the brain well enough to come up with different therapeutic approaches to help individuals that have had brain injury recover better, faster. And in that journey, one of the most potent inducers of neuroplasticity is nicotine. But I found very quickly that I couldn't separate any conversation outside of my laboratory when I spoke about nicotine without having to talk about cigarettes. That they're so innately tied to each other in the world outside that the drug itself, the nicotine compound itself, has become equally demonized as smoking, burning tobacco. And so at that time in my career, I started to think about, well, how can I move forward with research in this space around nicotine and neuroplasticity in a way where there'll be funding for the research, and I'd be able to have a conversation about this potential as a therapeutic. All these other things started to transpire that led me to take a position on the clinical team at Reynolds American tobacco industry. So I went from academics to big tobacco. I don't like to call them big tobacco, the tobacco industry. And when that transition occurred for me, I went from being seen as a scientist, the way all scientists want to be seen, that we have open methods, we are very clear and rigorous in our studies. But simply because I moved into this new position, I wasn't the same scientist. I wasn't perceived as the same scientist that I once was. Even though I was doing quality science and rigorous science, and the science was supporting reduced risk products as an alternative to help individuals move away from cigarettes and have longer and better healthy outcomes because of it. And so after fighting this battle of how, in science, if I disagree with you as a scientist, we can have that disagreement. You can talk about your methods, I can talk about my methods, you can replicate my study, I can replicate your study, and eventually there's some level of agreement in terms of what the reality, what the truth is. That conversation doesn't take place, and I think the World Health Organization is one example of it horribly not taking place. You don't allow for that open conversation that scientists are expected to participate in, to allow for information that people are going to be able to use to make decisions and choices about their lifestyle and their health choices. After 7 years working in industry, I realized that, well, if I'm only coming from the industry side, there's going to be people that listen to me, but they're going to be people that already agree with the industry side. And the folks that are outside of industry will never listen to what I have to say, regardless of what my data suggest. With 20 years of teaching undergraduates about the brain, I've learned, become pretty skilled at taking something very complicated and allow for people that are just learning in these space and don't really know all the right answers or the depth of complexity to it, being able to explain that to them. So last year I decided to move to policy, where I felt that I'd be able to bring individuals from both sides of the argument, the folks from industry that obviously their priority is to generate revenue, but they also are working hard to develop products that are less risky, less harmful as compared to the primary source of revenue. Talk to the individuals that are concerned about the health and welfare of their families, the lawmakers that are trying to decide what is the right level of regulation necessary, and be able to kind of build a bridge of conversation so that the complicated stuff becomes a little easier to understand, or at least accessible, and then potentially impact harm reduction by getting appropriate regulation put in place that allows for consumers to have access to products, at the same time allowing for the individuals that are producing these products to generate the revenue they need to stay in business. And so I think it's a balance of trying to get science into the argument so that instead of it being, excuse me, just impassioned discussion, it can have some grounding, some level of where people can agree and then move forward from that point forward.
Okay, that's interesting. This begs a question from me because, I study what the WHO does on a regular basis, and I read all their reports and stuff. And it's pretty clear to me that, I could mention the documents, but it's pretty pointless saying which ones they are, where you see science manipulated. So, for example, one of the reports for this COP said there is no evidence that vaping or e-cigarettes, or ENDS they call them, can help people quit smoking. And now to make that claim, they completely ignored a review by Cochrane Cochrane Library, which is the highest level of research and reviews. They completely ignored that one and just pretended it didn't exist. And then further down, they make a claim. I was just telling someone about this recently. But anyway, that's the kind of thing they do. And then they come out with there's no evidence for this and no evidence for that. How do we stop an organisation just completely cherry picking which science it wants to put in a review and which stuff it's going to ignore?
One thing I learned very early in my career was to be a scientist, you have to consider all the data. And any scientist that chooses not to consider data either has to have a strong rationale for it, because there's methodological problems, the analysis wasn't done appropriately, there weren't the appropriate controls. But short of that, all those data should be part of the conversation when you're talking about it. And so when scientists are, and it's not just the World Health Organization, the CDC, the FDA, there's lots of examples these days of individuals that are under the guise of scientific discussion and debate aren't really acting as scientists. I think it's the responsibility of scientists and really all individuals to ask the question, where do your data come from? What do they mean? And how do they relate to the other data that exists? And if there's disconnection between the two data sets, that's another empirical question that needs to be asked. The one thing that we can't do as a scientist is predict the future to the point where I can tell you that there will be 0 negative health outcomes for using a vaping product 30 years from now. I can look at the current tox data and say the likelihood of negative consequences of using reduced risk products is extremely improbable that there will be significant health declines due to the use of these products. Whereas on the other side of the fence, they're requiring that we say as scientists that there's 0 chance of long-term health consequences for these novel reduced risk products, which is an impossible statement to make with any kind of validity whatsoever at this point. So I think it really is the onus and responsibilities on as much as the consumers can, industry, other scientists in the world, hold them accountable for doing and acting as poor scientists. And I would do it to an undergraduate at a conference. I would do it to a senior scientist at a conference. It doesn't really matter. It's just a question of if you're a chef and you're trying to make a wonderful pizza, but you're using, the wrong ingredients, no matter how good of a chef you are, you're not going to have a wonderful pizza, right? It's the same thing with science. You can be an esteemed scientist, but if you're using the wrong ingredients to support your beliefs and your arguments, you're not going to have a product that's going to be an acceptable product. So I think to encourage the conversations, to be impassioned about it from your perspective, but more importantly, to listen from all sides. That's the best recipe for change if we're going to have change moving forward and increase acceptance.
Okay, just one small question on this. I've said regularly that the problem with tobacco control, it's got no regulator. It's constantly asking for other industries to be regulated very, very heavily, but no one regulates these people. So how, like I said, I'll kind of ask it again in a different way. How can the WHO and the FCTC process is totally unregulated. Yeah. There's no one we can complain to when they do manipulate science. So how on earth what mechanism is there to make them be truthful with the science? Because it is pretty crucial they should do, especially when they're dealing with public health and the number of people who die from cigarettes every year.
So someone from the United States who's not a signatory, it's really hard for me to have any kind of real insightful, advice from my perspective. From my perspective, the pathway to the acceptance of reduced risk products is going to really come from the ground level up, not from somebody at the top telling you that this is okay, you should do it, right? What I've written last year, a piece really critiquing the Center for Tobacco Products at the FDA. Not because of, it's hard to regulate these products, or it's wrong to regulate it this way, or it's right to regulate it this way, but more so holding them accountable because they've had 15 years to come up with standards and practices to allow for the products to be evaluated, right? And most companies can't afford not even a minimum, there's no real minimum. They don't know what they have to put into an application to have a successful application. So without standards and practices and guidelines, yes, if you were 2 years old, that would be, as a center, that would be reasonable. But it's been 15 years. These products have been on the market much longer than that. there should be some standards in place, and then holding them accountable. And the other side that we hold accountable is that they've been allocated $8.1 billion of, not directly from the taxpayer, but from the wallets of taxpayers. It comes from user fees and other, it comes from the manufacturers, but it still is always tied to the price of the product that the person has to buy. And so because so much money has been spent, and there's really no one holding them accountable, it's now time to start holding them accountable. And I think we as advocates and policy side folks can start pointing this out and emphasizing this as you know, the deaths in the U.S. have not gone down. You've had 15 years, there's still 500,000 people dying a year. What are you doing right?
Yeah.
And then talk about what they can do to be better.
That's a perfect lineup for our next expert here. Grant, you're a policy guy.
Sure.
So do you want to tell us about your organisation, why you're here, and maybe follow on from Jeff and see what you can do to this conversation?
Grant Carlson, I'm the Policy and Government Affairs Manager at the National Taxpayers Union. We're the United States' oldest taxpayer union. We advocate taxpayer advocacy group. We advocate in all 50 states in the United States Capitol and have over 300,000 members. I work on a lot of tobacco harm reduction related issues. Specifically, I think consumer rights are also taxpayer rights. And we look at it through the lens of the taxpayer and how certain tobacco harm reduction products help with the terms of the amount of government expenditures in the U.S. and also in terms of the amount of taxes taxpayers have to pay. I just looked up the amount of spending on Medicare and Medicaid. So in the United States, Medicare is a health service for lower income Americans. Spending last year grew by 6%, totaling nearly $1 trillion. So that's above inflation, but even more Medicaid, which is the government health service for Americans over 65, grew by almost 10%. Totaling $805 billion. These are definitely unsustainable numbers. Our U.S. deficit stands at over $35 trillion, and the taxpayers are left with that bill. And proposals in the United States to either tax some of these products at the same level as cigarettes and cigars, or even ban them. Recently, Majority Leader Schumer, who's a Democrat from New York and is the Majority Leader in the U.S. Senate, which is a very powerful position, proposed banning Zyn. There was a lot of outrage and pushback, and he backpedaled on his position, but there are a lot of those proposals out there where ultimately the taxpayer is harmed because these products are either taxed and made very expensive or not made available to American taxpayers and consumers.
So how do you think it's going? I mean, I work with Lindsay Stroud. She does a lot of these state hearings, and she puts her heart and soul into those. And it's a thankless task. It's one thing after another. I remember I've given testimony to Hawaii twice. Hawaii is coming up again at the moment. She's writing testimony for Hawaii again. You know, just these things just keep coming back. So just looking at your knowledge of how the land lies in Australia, in America, or I've been told United States.
Sure.
How do you think it's going? Do you think there's any movement either way, or is it just going to be constant gridlock at the moment?
Well, on the state level, a lot of lawmakers see taxes on some of these tobacco health relief products, nicotine-only products, as ways to raise money, but a lot of times there's a need for education and understanding that the potential health implications and that there is a difference between cigarettes or cigars, et cetera. So there's been a lot of proposals. Luckily, a few of them have failed, but now we're seeing that on the federal level with Senator Schumer. Also, the government is looking to ban some other related products from the FDA level. So it's a constant struggle, but it's important to provide education, and I think a lot of people don't view it through the lens as the average American taxpayer. We have an aging population in the United States, and they're on the hook for these healthcare costs. And youth smoking is at a very, very low level, but seniors and lower income Americans smoke at higher rates, and they're more likely to participate in these government-funded housing health programs.
Okay, I'll ask you about the FDA now. Since Brian King took over at the FDA's Center for Tobacco Products, he hasn't approved or authorized a single vaping product. Let's give a prediction. Do you think he ever will?
I would say that's highly doubtful. But yeah, I think the FDA and some of their leadership that's appointed there obviously has a very strong position on some of those issues. and sometimes does basically pursue almost a partisan agenda versus a fact-paced scientific agenda.
Okay, and one last kind of fun question, if you like. You mentioned Zinn there, and
Yes.
Senator Schumer.
Correct.
The pushback from the Republican Party was quite encouraging for me. Is Zinn now a mascot of the Republican Party in the USA?
I think it definitely has a little bit of a, kind of that frat bro culture, but there were also a number of Democrats who pushed back too. There were a number of prominent Democrats that said, you know, we have much larger issues in the United States to deal with than banning Zinn. I mean, it was really a theatrical program where Senator Schumer came out. He had all these charts. He had a huge press conference. It somewhat came out of left field, and I think some of his colleagues in the Senate from his side of the aisle were a little surprised and felt like the majority leader should be focusing on more important issues.
Yeah, I've been watching that in America. I go on Etsy occasionally, buy products, and you should see the amount of Zinn-related products on there. It's an amazing thing to see. It's almost gone viral, if you like, in America, isn't it? So, yeah, thanks, Grant. Just one last question to you, because it's just struck me, I forgot about this, that you're the only person really who's from Eastern Europe that we've got here, and we were really pleased that we got someone from Eastern Europe. I'd been trying to, for quite a while. So what's the view from Eastern Europe? You might have an outlook on how things are over there, maybe Russia, and can you give us an idea of what's going on in those sort of states?
Yeah, absolutely. I come from the country of Georgia, which is also part of Eastern Europe, and vaping is not banned in Georgia, but there is a very high excise tax. They actually increased it 5 times last year. And the worst thing that is happening is that you cannot talk about harm reduction at all there. So basically the government is chasing you. If you talk about harm reduction, they will say you're advertising the product and give you a fine. That's why many people are afraid to actually speak up, and consumers are also misinformed. Now, in different countries, there is definitely a different types of background. In Russia, for instance, there is a full-scale vaping ban, even though the smoke rates are so high, it's around 40%. So I don't think Russia has any intent to come up with a smoking cessation strategy. In Kazakhstan, for instance, they're on their way to come up with a full-scale ban again, and there is evidence of a huge illicit trade from China in Kazakhstan as well. It also depends on the country. In Turkey as well, Erdogan said that they will never allow vaping, even though they have 30% of smoking rate, which is also very high considering Turkey's population, and there's a huge illicit trade. So in the countries which are member states of the EU, the situation might differ a little bit because they might have policies that are more aligned with the EU. Let's see what the TPD will bring for them. But generally, I would say the pattern of prohibiting those products and how then this prohibition affects consumers is very much similar in all of the countries, whether it would be Eastern Europe or other regions.
So it doesn't sound like we're going to get much support from them at COP10, does it? I think. Anyway, I think we'll wrap up here, but I want to thank Lisa, Thomas, Jeff and Grant for their contributions today. It's been really good hearing from you. Thanks very much.
Thank you.
Thank you.
If it's still live, or anyone here, we've also got a live broadcast on Regulator Watch with Brent Stafford, which starts at 4 o'clock. So if you're looking for something else to watch, switch over to that, and you'll see me again in a few minutes. So thanks.